Welcome back. In the previous video, we learned how to recognize cardiac arrest, activate emergency services, and begin the chain of survival. In this video, you will learn how to properly perform CPR on a mannequin using chest compressions and rescue breaths. Remember, before beginning CPR, always make sure the scene is safe, the victim is unresponsive, and 911 has been called or an AED has been retrieved if it is available. Step 1. Positioning the victim. Whenever you're walking, you always want to make sure the victim is laying side, and then when you kneel down, it has to be perpendicular to your body. You also want to make sure that the victim is laying flat on their back on a flat surface, while also having access to their chest and their mouth. After this, you also want to make sure having good posture is important so that you don't overexert yourself. To do this, whenever you kneel up, you place your hands in front of your shoulders and you kind of distribute your body weight so that you have more on the front of your body and so that you can hold yourself up together. Let's learn the correct hand placement. You want to start by placing your non-dominant hand out in the front. Then place your dominant hand on top and then grab it. This will assure that you have a firm grip and you are able to deliver CPR. Place one heel of the hand at the center of the chest. You'll feel this by feeling the sternum, also known as the breastbone of the body. Chest compressions are the most important part of CPR because they circulate blood throughout the body and especially the brain. To put into perspective of just how important it is for blood to reach the brain, even though it makes about 2% of it, actually 1/5 of all the blood goes to the brain because it's so complex. This is why it is very important to play your part in CPR. Compress at least 2 inches deep for adults at a rate of 100 to 120 beats per minute. Some people find it helpful to memorize songs, such as Staying Alive or Another One Bites the Dust, because they have the same tempo that is used for CPR. This is very important because after your 30 compressions, you will be doing 2 breaths. After you compress once, always make sure you allow the chest to recoil fully so that the heart can pump the blood all the way to the body. Not doing this and doing it too rapidly can mean that blood will not be able to circulate as fast enough and the patient may develop an irregular heartbeat. Another important note is to not lean on the chest all the way. This can damage more ribs than it should, even though CPR already damages some ribs due to the force. Make sure to count your compressions out loud so that people around you can hear and understand and get help immediately if you get overexerted. This brings about a question of why it is important to not overexert yourself conducting CPR. While your body may be flooding with adrenaline to assist the victim and you may not feel exhaustion immediately, studies show that overexertion can occur just 2 minutes after compressing. This can lead to irregular compressions and lower quality care. It is increasingly important to have a team assist you so that you can alternate roles from time to time and increase the victim's chance of survival. Some common mistakes include compressing too slowly and forgetting the chest recoil. The next step of CPR is the rescue breaths. After your 30 compressions, you will begin by placing 2 fingers on the person's forehead and 2 fingers on the chin to tilt their head backwards. This allows the tongue to move and give room to air that will be delivered. The next step is rescue breaths. You want to make sure there's nothing lodged within the victim's mouth. You will then place your own mouth on top of theirs and while pinching their nose shut. As this is a mannequin, I will not be putting my mouth on it, but I will be demonstrating by saying, breath, breath. Notice my pace. I didn't say breath, breath. I said breath, breath. That is the amount of duration you need to give so that the victim receives adequate air throughout their lungs. This oxygen will also travel to all parts of their body along with the blood to keep their body alive. If a CPR breathing mask is available, utilize this technique, as you will not have to place your mouth on the victim. Here's how to utilize the bag mask. So you're going to start by securing the mask over the patient's nose and mouth using an EC clamp as shown. Since this is an adult, you want to press 2 times to regulate 2 breaths within the victim. And you will continuously do this after 30 compressions. However, in many circumstances, many individuals do not have this nor have an AED. So it is very important to contribute your part because CPR is assistance no matter what. As you give your breaths, make sure you notice the chest rise. If the chest doesn't rise, that means there's something blocking the airway. Let's do a full run through of what we learned so far. After you assess the scene, you want to kneel down immediately and place your cheek near their nose and near their mouth so that you can feel for a breath. If a breath is unable to be felt or heard, direct someone else. You call 911 and you get an AED. Another really important factor is making sure the victim has a pulse or not. You can do this by placing 2 fingers on the side of their neck and feeling for the carotid artery. If there is no pulse, then contact emergency services. You then want to start CPR immediately. Remember placing your hand on top of your others and then pressing down on their sternum with all force, 2 inches deep for adults. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Breath, breath. Continuing the process. Do not stop CPR unless the person begins breathing, emergency responses arrive, you physically become unable to, the scene becomes unsafe, or the AED is ready to use. If a victim happens to gain consciousness during CPR, it is known as cardiopulmonary resuscitation-induced consciousness, or CPRIC for short. It is when patients exhibit signs of awareness or movement while receiving chest compressions. This usually occurs in younger patients, but you should be equipped with the knowledge of how to handle it no matter the individual. The goal is to maintain CPR with as few interruptions as possible, often by reassuring the patient and even physical restraints. Healthcare providers often have ketamine, but usually patients don't recall pain as the lower levels of oxygen to the brain cause memory dysfunctions. As mentioned earlier, the AED analyzes the heart rhythm and can deliver a shock if needed. It can be found in schools and public areas. It is important to know where these belong in your schools. Something I think would be really important for you to know would be that there are actually apps out there in which you can locate and register your own AEDs so that citizens around you can have accessibility and awareness that there are multiple resources to help them in an emergency situation. Through these, you can also create a location awareness, and you can also help cardiac arrests that happen outside of hospitals. This device gives verbal instructions, step by step. Today, you learned proper adult positioning, hand placement, compression technique, CPR ratios, and basic AED awareness.